So we're now, I believe, tied for the second longest government shutdown. What impacts specifically in our area are you starting to see?
So I think there's many, and people are starting to feel that, and I think the uncertainty is felt by many. I'm thinking about the people who are working and not getting paid, federal workers. And top of mind for me is both food security, so SNAP benefits, and MFIP benefits, which is cash to low-income families who need it. As we get further into the shutdown, if we get into November, there are going to be families who do not receive their SNAP benefits, which is formerly known as food stamps. So that food security is really concerning to me. That is, many families in our community and across the state who rely on that and won't have access to those benefits if this continues.
Let's talk specifically about health care. How is this impacting that?
So as part of the bill that was passed at the federal level, there's going to be big impacts from that. And so that's separate from the shutdown, but also concerning in terms of people losing access to health care, in terms of people losing access to their Medicaid. The focus of the shutdown really is health care because the premium tax credits that was part of the ACA that help people afford it subsidizes their healthcare insurance premiums, keeps those prices low. Those are set to expire. And so what we're seeing is those prices skyrocketing. People are starting to see that now as they're looking towards, what is my health insurance going to cost next year? And that is what the federal Democrats are fighting for, to say those tax credits should continue. We need to help people afford their health insurance. And so, really emphasizing the importance of people having access to affordable care is certainly something top of mind for me.
So along those lines, not shutdown related, but something making headlines right now is that Medicare Advantage networks, United Healthcare and Humana, are not working with Mayo Clinic anymore. So that's going to leave thousands of patients without coverage or seeing the doctors that they need to see. What is your message about that?
It's concerning. I mean, everyone deserves access to the care that they need. And I will say it's confusing to people. I spent a good portion of my weekend helping my mother, who is on Medicare, trying to figure out her plan for next year, because the plan that she currently is on isn't being offered, won't allow her the coverage that she needs. And so, myself, who's, an educated person, I work in healthcare, I've got access to resources. It was, it took some time for me to navigate that system. And so I think about what that looks like for other people who don't have the resources or the background that I have. It is confusing, it is difficult. And so there are resources to help folks with that, but they're overwhelmed right now. And so it's definitely concerning because everybody deserves that care.
Okay. Let's go back to the shutdown. It takes two to tango. No side is perfect. So without criticizing what other parties need to do, what is your party, what do Democrats need to do in Washington? What have they done wrong? What do they need to do to end this and to get back to work, to get people back to work?
Yeah. I would say, just as a background, we know that Republicans control every lever of power at the federal level. They have a trifecta. They are in control of the presidency, the House, the Senate, and essentially the Supreme Court. And so that is just the foundation there. But what I will say is Democrats are fighting for health care. They're fighting to be sure that people can afford their insurance premiums. They're fighting to ensure that hundreds of thousands of people are not kicked off of Medicaid. People need health care, deserve health care. And there are solutions there. There are things that we can do to move in that direction. And that's really like the floor, the bottom line of what we should be doing.
Okay, so what are those solutions? What are they missing?
So currently, the fight is for the extending those tax subsidies that were part of the ACA to be sure that people can afford their insurance premiums, and then removing the draconian limits on Medicaid to be sure that people can stay on Medicaid. Those are the two biggest things right now that can be, again, it's the floor. It's not everything that we need to do, but things that happen in place that should stay in place so people can continue to get care.
Okay. Is there anything that you wanted to add before we wrap up here?
I would just say that the chaos and the confusion that we are experiencing from the federal level is really impacting people, and people are feeling that. And so it is imperative that we, in Minnesota, we are doing what we can to understand the impacts and do what we can to mitigate those, and certainly want to be sure that we are fighting for people to have the care that they need.